Angel, this is Jamie Lewis. I'm just going to be on the phone, okay?
Okay, thanks for joining us, Jamie. Malia, did you want to say something? I see your hands up. Malia Monson, you want to?
Oh, it muted me. I just wanted to let you know that I'm on. The last couple times I've come to the LCC, it's letting me know I can't send messages in the chat because I'm not a member of the chat. But I just wanted to let you know I am here for roll call.
Oh, great. Thank you so much. Is anybody else having problems with adding to the chat or chatting if they're using the web browser instead of the app?
This is Rashan from SPAN, and I've had the same situation. Yeah, I've been here the last couple times, but I'm not sure I'm being counted. So, yep, I'm here.
Okay, well, thanks. Welcome.
Thank you. Yeah.
Hi, this is Ann Bartles, too, from Pasco. Same situation.
Great.
Yep.
Thanks.
Super for community cycles, same thing.
Okay. Thanks, Sue. Okay, so let's go ahead and get started. It says that we have about 29 people in the call. So it's about on target. So I'll go ahead and get started. So welcome to the Boulder County Mobility for All Local Coordinating Council. Our agenda isn't as full today as what it has been in the past couple 2 or 3 months. So I think it'll give us some opportunities to chat a little bit more. Thank you all for coming. I'm just going to go over some housekeeping before we get started. You all made it, so I'm assuming that you know how to join Microsoft Teams, but in case you get kicked off or if you want to join the next time, there are 3 ways to join Teams. The first is to open in the Teams app, and you would do that by downloading the app either on your mobile device or your computer, or you can join in the web. This does work better if you're in Chrome, but if you don't have Chrome, that's fine. It should work all right. There are some functionality issues that don't work when you're using it through the web. As we just found out, people can't use the chat. If for some reason you get kicked off in the middle of this, you can always join by calling, and the phone number to call into is in the invite that I sent out and also the email that I sent out earlier today. So if you're joining on your cell phone and you just have your meeting in your calendar, you should be able to just click on this number and it automatically enters in the conference ID for you. So I'll go over some of the functionalities which may be available depending on how you've joined the meeting. So the video does help with communication. I know you all can't see each other right now, but when we get into discussions, we might turn off the presentation so that we can see each other's faces. I can see probably about 9 people at a time, like on my screen. I have 2 split screens here, but try to mute yourself if you aren't speaking. That just helps with some of the background noise, and sometimes we get into a situation when people are joining on multiple devices where we get an echo. If you can, type the comments in the chat function, or you can unmute yourself to chat as well. You can also, if you want to share any links, this is a good way to share links for the rest of the team. You can see who else is on the call by clicking this person icon here. And it will give you a list of who's currently in the meeting and then others that were invited. We are recording this for meeting minutes, and then also I will upload it to our YouTube channel so that you all can watch it after the fact or share it with somebody that wasn't able to attend. If you're using the app, you can turn on live captions. You do that by clicking on these 3 dots and it will bring up the screen. You can turn on the live captions. I don't know how well this the captioning works, but I think it's a relatively new feature for Microsoft Teams Government. If you're having technology difficulties, like the video's kind of jumping, lagging, you can turn off incoming video and just listen to audio. That helps sometimes. Also, you can try turning off your own video because sometimes that'll slow down your connection as well. So we'll go ahead and just do introductions in the chat. If you haven't introduced yourself already, you can either put it in the chat or you can unmute yourself and introduce yourself now. Is there anybody who wasn't able to add their name to the chat function?
This is Joni Lynch with the Hour Center in Longmont. We're having trouble with our internet today, so I can't even, it's waiting for it to cache. So, oh well, I'll just be on the phone, I guess. Thanks.
Okay, well, we will record the meeting and you'll be able to see the slides after the fact. So Katie says that her chat function isn't working, but she's using the browser. So I think that that was the problem that some of the others were talking about how if they're using the browser, they can't chat. Hi, Juliet, how are you? I see Laura on the call. Katie, welcome. Michelle, welcome. Rashawn, welcome. Let's see. We have Danny, welcome to the call. Aiden from Mobility for All. Anna Stewart from BVSD, Parent Liaison. Aaron Pastors, Whitney Wilcox, Jackie Myers. Let's see. Scott McCary, Lindsay Parsons, Anna Colon, Bill Sweeney, Lindsay Morse. I think we're caught up there. Let me scroll back down. Eugenia Brady, welcome to Eugenia. Okay, so we'll go ahead and get started. I'm sure that there will be others that will pop in throughout. But just a reminder, we meet the second Monday of the month from 2 to 4 p.m. We're meeting virtually until COVID is over, but we typically do odd months in Longmont, even months in Boulder. The purpose of this is really to bridge transportation and human services to ensure that people are safe or thriving in their transportation options. So we really do take the approach of multimodal transportation access as a social determinant of health. And this pedal graph over here to the left really does demonstrate that transportation is kind of that linchpin service for the social determinants of health. And it's what allows people, to access education, work, health and well-being, food access, and we do talk about that transportation housing connection as well. Today's agenda, we're going to do some organizational updates. I'm going to give an update on the technology workshops that we've been conducting. We'll also talk about Ride Free Lafayette, a little bit about Rtd Live Program. I'll debrief on some of the grant applications that we've applied for. VIA is going to give an update on their new merger with, I don't know if merger is the right term, but their new partnership. They took over Senior Resource Center in Denver, Jeffco, and Arapahoe County. We'll get a briefing by Commuting Solutions on State Highway 119, and then I'll touch on some of the program evaluation that some of you participated in. And this will just be a starting conversation on this because we got lots of good information on that evaluation. So does anybody have any questions before we get started? No? Okay. So for the Mobility for All Technology workshops, I just wanted to give you guys an update on some of the numbers because we initially said that it would be a 6-month pilot to see how things were going, and then we would reevaluate after 6 months. Of course, COVID has kind of thrown things, changed everything basically. But what we've done is we've trained 20 ambassadors, and those are volunteers who work with other older adults and people with disabilities to help train them on the apps. About 9 of them have remained active since COVID, and about 9 of them feel comfortable doing that volunteer work in person, or not in person, but through the virtual setting. About 11 of them just don't necessarily feel like they can contribute to the same level as what they had planned prior to COVID. We've done 25 workshops so far in 2020. 17 of those were pre-COVID, and 8 of those have been post-COVID. We did 4 of them that were kind of a refresher for people who had attended the previous sessions before. So we basically sent out the invite for the first 4 of these virtual sessions to the people who attended these 17 sessions, and we opened it up to our ambassadors as well. So far, we've had 137 people attend the workshops. We've had really good attendance, so in the virtual session. And some of these, just a note on the data, I haven't been able to test out the ambassadors' attendance and post-COVID, but the pre-COVID numbers are the ones that don't include the ambassadors' attendance as well. So this is a little bit higher if we're going to compare apples to apples. So I will work on trying to count like how many of these 91 people who have attended the workshops post-COVID have been ambassadors. But generally speaking, I think they've been going fairly well. We have had some tech difficulties. I know that Sandy Stewart's attended a couple of them. I don't know if you want to unmute yourself, Sandy, and make any comments.
Well, I think they've been really helpful reinforcing what I had learned, but since I haven't been using the mobility apps because of COVID, I'm probably going to have to be trained again. But anyway, they're good and they're really hands-on. You answer questions and your whole team does an excellent job. So I've been really happy with it and have encouraged my circle of friends to sign up.
Yeah,
it's
great.
Helpful. Thank you.
Yeah, they have been helpful. And I do feel like with COVID, a lot of people it seems like they're attending just for entertainment more than actually going to be out using it. We haven't had as many people tap into the free credits. So if those of you who aren't aware of how we set it up, we have 4 workshops now. So we have using Uber, using Lyft, using RTD mobile ticketing and transit together, like transit app together, and using Google Maps. And we go over how to do multimodal trips on all 4 of those workshops. And it does seem like a lot of people are attending just to like do something like during the day because they don't feel comfortable traveling. I do think that we probably will have to do some more refreshers once people feel comfortable going out and about. I think that the biggest learning curve I've seen so far with doing it online really has to do with just that assumption that everybody can join online needs to be checked, right? Because we have to like train people how to join on Microsoft Teams. And if we had something like Zoom, it might be a little bit easier because more people are familiar with Zoom. But that's like an organizational capacity issue because Boulder County is using Microsoft Teams instead of Zoom. I don't know if anybody else who has attended these has questions or comments on these. No. Okay. We have been recording the sessions, so if you're interested to see what those sessions look like, you can reach out and let me know, and I'll send you. We've been uploading those to our YouTube channel, but they're hidden so that we just send people the link. So if somebody has the link, they can watch it. The reason why we did that is because we want people to feel safe asking like stupid questions, what they consider to be stupid questions. And so we just keep them hidden. And then we just send the attendees the link to the video so that they can rewatch it. Okay. So next we have Ride Free Lafayette update. So for those of you who don't know, Ride Free Lafayette is a partnership that Boulder County has. We've selected Via Mobility Services as the contractor to operate the service, and Commuting Solutions is doing our marketing. Scott sent me this update just prior to this, but he said that they're making a video, that they're working on wrapping the bus. They're creating a new map, and he would like some feedback on what this map looks like. And they're working with Thorn Nature Center or the Nature Group to get access to the art center in Lafayette for vulnerable and underserved kids. So that's really exciting. We've only been operating for what, 3 weeks, Scott? Yeah. You want to talk a little bit about how the Thorn Nature Group partnership happened?
Yeah, actually, one of the city council members is pretty familiar with the group, and they're starting up in a couple weeks. So it just seemed to make sense that they're focused on low income kids in a couple different neighborhoods in Lafayette. So yeah, we're going to try to get them on kind of a more organized, scheduled ride for that.
Great.
Yeah.
So Juliet, I know you're on the call. Did you want to talk a little bit about the presentation to City Council? I know Scott and Audrey De Barros gave a presentation to City Council.
I'll just say briefly that it went well. Scott and Audrey kept it short. Our council was very excited, and one of our council members even pulled up the app and accidentally ordered a ride. So they were all very excited about it. You probably heard we were having some network issues at the city, so we're a little disconnected right now, but everything I've heard has been very positive.
Great. Lisa, do you have any questions or do you have any comments from like an operational standpoint? I know that it's a new software that you're using. You're not using your typical route match.
Right, we're using Pantonium, and so far so good. I have numbers for Lafayette for the month of July. We ran 12 days for a total of 156 hours. I don't have how many people have ridden. I'm waiting to get that information. And also it would be cool to see how many use the app versus calling in on the phone. So we'll see if we can start getting that information too. So should have that in a day or two. Awesome.
Great. So they're using Pantonium, which is a new software system that they were not using before. So they're testing it out, and from what I understand, you guys are trying to replicate some of the findings that Pantonium had in Canada. Is that correct?
Yeah, it's basically their off-the-shelf product. They're still working on their paratransit the stuff that they were working on earlier in the year, but COVID hitting that sort of put that on hold. But this is their off-the-shelf product. It's in Canada and several other places. You can see them on LinkedIn, and you'll see that they're really ramping up and getting in other areas, both in the United States and Canada. And so far, so good. We're learning it and getting ourselves comfortable with it and seeing what it can and cannot do. And probably another month, by the end of this month, we'll have a lot more to report and, what we think of it.
Great. So this is kind of an off topic, and I don't know, Lisa, if you feel comfortable answering this, but has anybody heard how the acquisition with Uber has been going with Route Match? Any inside scoop on that?
I do have some inside scoop on that. So Wednesday, we have a meeting with Route Match with Daisy, which is their vice president of publication and what they do there at Route Match. And we've been talking to Route Match because of our acquiring the transportation part of SRC, because we have to combine our two route matches. I think it's a really good thing. I think that each piece, Route Match and Uber, have something that the other didn't have or didn't have as well. So my take on it from the conversations with them is that Route Match is good at the paratransit world, and we know that Uber is good at the on-demand world. And so now you can put the two together. I think it's a game changer. I think it's really going to enhance Route Match's ability to have a wonderful on-demand product. And it also enhances Uber to step into the paratransit world where they've never been. So it sounds like a really good merger. They're very positive about it, very excited about it, and I think it's really going to jumpstart the on-demand for Route Match. And I expect to see some pretty great things coming from it in a short amount of time to be able to put something like that together.
Great. Yeah, I was hoping that maybe they could help with like that human-centered approach. Route Match could help Uber with that human-centered approach a little bit more. So
I think that they will. I think it's going to have to be a little bit of give and take on both their sides, and I think that they're very open to do that from what I've been told. And like I said, I have a big meeting with them on Wednesday and sort of get more in the weeds of, what it's going to look like and what they expect and what the outcomes will be. But pretty exciting stuff. And I don't see any downside to it. I only see good coming from it at this point.
Great. Thank you. So the next topic we have is the Rtd Live Program. So I'll go ahead and take this. So some of you know that during our strategic planning meeting that we had in December, we talked about the need to promote the Rtd Live Program. And I know that RTD is also doing some more outreach and engagement. And I don't know, I see that Bill Sweeney's on the call. I don't know if RTD staff has reached out to the Bridge House or the Boulder Homeless Shelter.
I know we haven't heard from them, but that doesn't mean we, all I can say is we haven't heard from them.
Yeah. So they, the last I heard is that they want to work with the domestic violence shelters and the homeless shelters to see if they can overcome that gap. So for those of you who need a little refresher on this, so Rtd Live Program is the low income verified eligibility program, and it's eligible for anybody who is at 185% of the federal poverty level or lower. But people have to apply for this program through the PEAK system. The PEAK Connect system is the application system that gets people enrolled in the Colorado Benefits Management System, which is basically how people apply for SNAP benefits, for WIC, and for Medicaid and such. There's been some technical issues with people not uploading their picture at the right time. And since the Rtd module was added on after the fact, it's not integrated with the other like SNAP program or anything like that. It's kind of its own module. So basically Denver Human Services is responsible for managing that portion of the PEAK system. So last I heard from RTD, they are modifying their contract with Denver Human Services to have a roving outreach specialist who's going to be going around to the nonprofits, especially the nonprofits that serve domestic violence survivors and homeless individuals in order to ensure that they can overcome some of those barriers. I've asked RTD for some data that's specific to Boulder County because we want to launch a promotion program and train nonprofits how to help their clients get signed up for the program. But we really want that baseline understanding of how many people have signed up for the Live in Boulder County before we start launching that. They are working with Denver Human Services in order to get that data. But the way that it's set up is to where RTD can't get any of the personal data for people who applied. So it's a huge barrier. So basically, Denver Human Services is going to have to go through all of the data and kind of disaggregate it and then send them the raw numbers on how many people have signed up in each of the counties. So I will be sending out a meeting invite to our LCC members, and I've reached out to our PEAK Connect outreach coordinator, and they have a video walking people through how to help people sign up for Live through PEAK. So I want to meet with some of our members, the LCC, and then also HHS's partners in August. By the end of the month, I'll send out a doodle poll so that we can talk about how to get some transit pass subsidies in the hands of people who have signed up. So right now it's in development phase, but what we're thinking of is people could get 2 months of transit passes paid for by Mobility for All if they sign up for the Live program as a way to incentivize people signing up for the Live program. So we've developed the mechanism for partner agencies like you all. If you help your clients sign up for Live, you can request Live mobile passes on behalf of your clients. And then for a couple months, we'll subsidize their transit pass in order to get them to want to sign up for it. Also, what we're talking about is doing a marketing campaign. You'll see right here, this discount fares. RTD is going to be promoting their discount fares like as a package deal. They're not necessarily going to be promoting just the low income eligible program. But this is their new campaign that we talked about in January, I think, when we were in Longmont last. But basically, they're on a lot of the buses, they have the youth discount, senior discount, special discount card for people with disabilities, and then the live discount promotion on their vehicles. But we're going to see if we can work with Lamar, which is their bus marketing, like on their bus, like all of the ads on their buses or in their buses are run through Lamar, like where we're at. So do you have any questions or comments on how we can ensure that this promotion meets the people or is effective for the people that we are going to work with? In particular, I think, Bill, I know that you've been outspoken about the barriers that impact your populations that you serve. And I know that technology is continually a barrier.
Sure, and frankly, everything I've heard from you today is we haven't made a change, we've only painted it red. And, you know, maybe, who knows, maybe red's going to be more appealing or something. But for example, to have a community that doesn't uniformly carry smartphones, have a program that requires a smartphone, you know, they haven't changed that. So I'm not sure how that's going to work out.
Yeah. Any other comments or questions?
Whatever comes across the table, but so far it hasn't. It has not so far been very workable.
Yeah. Rashawn, are you still on the call?
I am. Yep. Our concern and this in general about this program, I think, has been, folks who can't access peak or don't want to, issues with documentation status, for example, safety around, accessing resources that way. And then the speed seems to be, one of our questions. And then always, obviously, the confidentiality piece. But yeah, I think the speed of how do we get things into people's hands when they're moving quickly from one county to another is So, and I know you're thinking of all those, and so I appreciate your working as a little bit of a go-between for us and asking these questions. Thanks for doing that.
Yeah. Has RTD reached out to you? I think it was Kimberly Ford who was reaching out to nonprofits that were having particularly hard time transitioning to the LIVE program. Have they reached out to SPAN?
I don't believe so. If they have, I don't think it came through me. I'll double check. Kimberly Ford, you said, is the name to look for?
Yeah.
Okay. I'll double check, and if not, if you could share that contact with me, I'll be happy to reach out that way if it'd be faster.
So, I mean, this is just a really challenging situation because I know on my work plan, I have to promote the low income pass program for RTD, right? Right. And for one of our Boulder County, the Board of County Commissioners, the Boulder County Board of County Commissioners, we have what's called the strategic priorities. And the number one priority is to address affordable living. And one of our goals under that is to promote the low income pass program. So I really don't think that I have another workaround other than training you all and some of the nonprofits who have direct contact with people to help you get them signed up, and then I can incentivize it through our priority. And I'm just kind of at a loss other than marketing it and working with you to promote it, how to overcome some of these structural issues.
Yeah, I think we're all stuck. I really appreciate your the work you're doing, and I'll happy to reach out and see if I can connect with Kimberly directly, and maybe we can have a deeper conversation. I appreciate that.
Okay. And then also just the turnaround time for the card is really slow right now too. And I will look through some of my old meeting notes that I took, but I think that it's been 3 to 5 weeks for people to get the card, which, I mean, if you want people to use a new service and a new system, then you want them to have it quicker because you want them to be able to leave with the ability to use it. And so that's just really frustrating. And especially now with COVID and more people seeking benefits, the whole Colorado benefits management system is just really much slower because there's more people, from what I understand. Scott, I see that you have your hand up.
Oh, thanks. Yeah, I was just going to mention that as part of the PASS program working group, the reason that they they got to 40% rather than 50% was because they had these wild projections of the number of people that were going to sign up for the program. And the RTD said, oh, we simply can't afford going to a 50% discount, even though we kind of were pushing for that. One, because it's a better benefit, but also two, because it's just simpler. You know, there's obviously this tier structure is kind of hard when you have your senior parent, you, and then your child. It's like you have to do all this crazy math. So I don't know if it's a little bit tangential, but it might be at some point, it might be good to have a push to say, okay, not as many people signed up for this as you thought. We increased the fares for the local and the regional routes proportionally such that we could afford a 40% discount. Can we afford a 50% discount? And I think internally, operationally wise, the staff would appreciate that. So that's one less fare category. It's a little bit easier. But it might also be an incentive to sign up for it because it's an additional 10%. So that could be something. I'd be happy to work on that if others thought that was a good idea. And so that was it.
So I guess I would like to know, and I've asked kind of informally, I think, I don't know, do we have anybody from RTD on the call today? I know we had like 3 people last month. Let me see. Okay, so I talked to Teresa about it, and I just don't know in the like grand scheme of things, like how much they are promoting this, because they have so many issues with COVID. And just like the reason why they started charging fares on July 1st was because of the budget situation, right? And so, I mean, I don't know from like their board standpoint how much of a priority promoting this is. So I think that maybe next steps, perhaps we can invite somebody to come talk to the LCC from RTD, and maybe that will raise the issue. I know last time I invited Lynn and Judy at the same time, and that's when they were able to come and give presentations to the LCC, but perhaps we can invite them and then also invite Lynn and Judy, depending on the timing of if it's after the election or not. But okay. So does anybody have any like amazing ideas on how I can help promote the LIVE program, given the structural flaws that we have? Okay. Well, if you have any wonderful ideas, please email me because right now I'm stuck with just like taking out bus ads and working with the basic needs nonprofits. Okay. So next, I just wanted to follow up on some of the grant coordination that we talked about the past couple of sessions. So Boulder County did apply for the Dr. Cog Human Services Transportation Set Aside. We applied for year 2 of the Ride Free Lafayette, and then also the RTD Access-Ride Certification Center feasibility study. I just want to thank all of you who were able to submit letters of support for these projects. I think that we got a letter of support from RTD for the Access-Ride Certification Center, and then Paul Hamilton also followed up and said that they're releasing their new RFP, and they're going to include the potential multi-site certification in that RFP. So that's a good sign. And what that certification center feasibility study will look like is we will go to the Easter Seals. If we get the grant awarded, we'll go to Easter Seals. Boulder County's architecture staff, we have building services staff, have said that they would go help us do a schematic draw up of the current site. Then we'll bring those back and we will talk about possible service delivery. Is there a different way of doing it? Do we have to have people come into like one central area? And of course, we'll be working with RTD on this. And then what we'll do is really analyze like where people are signing up from geographically for Access-A-Ride and see if there's a location within Boulder County that we could construct a certification center. And then hopefully we would have some pretty good cost estimates of what it would cost to construct that certification center if RTD is all on board with us doing it. And then we would do a site selection for that construction or a service delivery construction. Like if we end up, if RTD is on board with us, like having it in a trailer that we can bring to senior centers or something. And that was something that Michelle had brought up. So the project would be going forward next year, and hopefully we would be able to apply for grant funding to construct something either mid-year next year or after that. So I don't know if you have any other questions about that certification center or barriers to that. No? Okay. So Anna Stewart, I don't know if you want to talk about that. I know that was a big issue for you and the interagency transition team. Are you still on the call?
I'm still on the call. Yeah, no, I'm just excited that you've moved forward with this and getting the RFPs in and looking at the feasibility. You know, it's more than Boulder County. It's really looking at a lot of the counties north and east of us could really benefit from this. So it could really give a lot more people access. So I am thrilled that we're moving forward with this. Absolutely.
And we'll see if we get awarded the grant. But also another grant that you all had submitted letters of support for, some of you, was the car share proposal. So it was the Next 50 initiative. Boulder, so VIA Mobility Services was taking the lead on this grant application with Ego Car Share. And we were able to get letters of support from Boulder Housing Partners and Boulder County Housing Authority for this. But the idea was to have 2 or 3 cars located at housing authority locations, low-income housing authority locations. So I'm not sure when we'll find that out. I don't know if Zoe's on the call, but she did a wonderful job of getting the grant applications together and submitting it on behalf of all 3 organizations. Mobility for All is included for the technology education. So we would basically we would develop the curriculum for the Ego Car Share for people to be able to reserve the cars online, and then we would help train people at the housing authority sites. So I thought that was a great project. Does Lisa or Lindsay, do any of you want to chime in on this? I know you weren't really involved in, but
yeah, I'll chime in to say I don't know. I don't have any updates.
Great.
Yeah,
oh, Lisa Curtis. I see Lisa Curtis on the call. She was probably like, Lisa Curtis would know. Lisa, do you have any comments?
No, I don't have any updates yet. They received the grant application and they were happy to receive it. We also had letters of support from Fraser Meadows and from Golden West that went in with the application. So that was good.
Yeah, that's great. That's exciting. And then, sorry, go ahead.
We'll keep our fingers crossed.
Yeah, I think it's great. We also got a letter of support from Boulder County Sustainability Office, the OSCR, the Office of Sustainability and Resiliency. Lisa, Lisa Curtis, did you have any other collaborative grant applications that you wanted to give an update on before we moved on?
No, not right now. Thanks.
Okay. Great. Okay, so does anybody have any other transportation updates or barriers that your clients are experiencing right now? Okay, we'll go ahead and move on. So now we have VIA. So Lisa Bitzer, I know that you and Lindsay were going to tag team this update.
Yeah, Lindsay, you want to go first?
Yeah, so I am going to attempt to share my screen, which I've never done on Teams before. So is it working?
Yep.
Okay, great. There we go. So basically, just providing you guys with a visual, and Lisa can talk about it more in terms of where our service area is going to be. And can you guys see this presentation or slide now?
Yeah.
Okay. So overall, the transition has been really great. We've gotten a lot of really good feedback from folks who are now VIA riders, and we're doing our best to chip away at those denials that they were experiencing. And I've heard nothing but positive feedback from everybody. And that's really it on our end. We're going to be doing a bigger push September early October, because we have a launch date of officially having everything moved over into our database the 1st of October, unless that's changed since last week, but I believe it's going to be the 1st of October. And we're looking forward to that and educating folks about, using the VIA phone number. They'll still have access to use the other phone number if they choose to. And then getting more people on board with the service, since we're not currently accepting new riders, but that is our goal, to start accepting folks by then. And then we're hoping once we have funding for it, we will be able to start offering those trips between our current service area, our old service area in Boulder County, and the new service area in the Metro Denver region.
Yeah, and we've done quite a bit so far as the operational piece of it. Of course, hiring drivers. When we took over the transportation part of SRC, they had approximately 12 drivers. 2 of them were OpSpecs or leads. And with the dispatch person and the operations manager and 2 call center people. Not sure if the call center people are going to come with us still. We're still in the transition of what that might look like. Everyone else came over to VIA. And so the biggest thing is hiring drivers. In order to provide more service, we need more drivers. And then once we get more drivers, we can expand the time frame. Right now, they're doing approximately about a 7:30, 8 o'clock in the morning till 2 in the afternoon. So what we've been trying to do to alleviate some of that, when we have some extra drivers up here in Boulder, we send them down to SRC, down to VIA down there. And we go ahead and open up our hours and try to get rid of some of those denials, chip away at them. So we've been doing that for the last couple of weeks, and it's making some impact. One driver is getting ready new driver is getting ready to be released to service, I believe, in the middle of this week. Another one is in training that started on August 6th, and we have the possibility of 4 more drivers for the next training class, August 27th. It takes about 4.5 weeks to go through the entire training process of in classroom and out on the road driving before they're released to service. Like Lindsay said, no new riders at this time. We don't want to go ahead and have new riders get put in to be told, no, sorry, you don't have a trip, put you on the wait list. So as we can expand service, and hours with more drivers, then we will start taking new riders. And then doing training, down there at SRC, they did things a little differently than what VIA does. So just getting all the drivers used to our policies and procedures and how we do things and all the training. We even do a COVID training to know how to handle the elements out there when you're taking people to and from. So we're doing those kind of things, getting all the buses wrapped. We're using Summit down in Commerce City, and right now they're really busy, so they're only able to wrap 1 vehicle at a time, so it's a slow, tedious process. But we take one, they wrap it in a few days, and then we go get it and leave them another. All the uniforms have been given out, all brand new uniforms, badges, etc., cleaning supplies. And then, of course, just put out there, all of our brochures are going to have to be changed a little bit. That's something that Lindsay and her team are going to work on with me. And we have to add all the extra service. And then once we get the software pulled over into one software, there are a few versions behind us on Route Match. And also what the future will hold for us. We will be able to, once that's done, and like I said, the go live date is going to be October 1st. So far, so good on that date. People will be able to use our web portal to go ahead and book rides through the web, online. And then we're also in the conversation with Route Match about doing on demand, which would be really cool to be able to do, and especially with their new merger with Uber. So, that'll be further down the road. But I see good things coming, and just trying to learn it all and put it all together and get drivers out there so we can help more people. And and make a difference. So far so good. The people down there are fantastic. We're very pleased with who has come aboard, and we hope to continue to make it a seamless transition.
Yeah. We'll make sure that we pass along all of the literature that's updated and any sort of social graphics, email language, that kind of thing. Once we've got that ready, I'll give it to Angel to give to the group.
Awesome. Thank you guys. And I think Hank might have hopped off, but oh no, I see him here. So I hear that Hank's going to be working for you guys full time now. At first I thought that it was going to be a contract. So Hank, do you want to introduce yourself?
Yeah, I'm helping. I'm with government relations. I think it's more a temporary position, at least through September, just helping them get in touch with all the right people in the different counties that they're now in. And, I have to agree, the transition has gone really well. When COVID hit mid-March, we dropped 80% of our staff, writers. And then by May, the agency made a decision to let the program go. I'm very, very, very pleased that VIA stepped in. Can't think of a better home for the transportation to land. And I am confident that going forward, it will grow beyond everyone's expectations. So I'm very, very thrilled.
Yeah, that's great. I know it was kind of bittersweet when I heard about it, but I'm glad that you're helping with the transition because I know it's your baby.
It's in good hands, though.
Okay, so I see that Christina from RTD hopped on. Christina, do you want to unmute yourself? That you said that you have some RTD Live program. Do you want to unmute yourself and talk about the RTD Live program a little bit?
Yeah, sure thing. Can you hear me okay?
Yeah, we can.
Perfect. Thanks for giving me a little bit of the mic minutes here. So we do have some materials coming out this Thursday. What we're working on is updating our website and adding a partner toolkit, which would consist of information that you can plug into your email lists or newsletters. And really the whole point of this is to point people to some resources that we've been working on, which includes a series of live videos. There's about 3 little short videos. The first one's going to be introducing people to what live is. The second one's going to be a little bit longer of the 3, which is going to walk people through some of the common areas where there's pitfalls on the application process. So where people usually get hung up, or we get some frequently asked questions in the application process. And so that's what the second video is kind of based around. It's about 3 minutes long. And then the third video is going to talk about what you do once you have your live card. So now that you have 2, it does take 2 to use the live card. You need your live card, you need your fare. And so just some of the tips and tricks behind that. So these are meant to be things that could be shared on social media, especially the video number 1 and 3, because they're under around 30 seconds. These are available in English and Spanish. They do have closed captioning, which someone can turn on and listen in on. So something, that's kind of hopefully all encompassing. We did our best to include as much as we could in these videos, but all of them always point towards the resources on the Live page where people can get in contact with the people they need to when they've got those really specific questions about their application and application process. So again, this will all go on our webpage. It's going to be all bundled into the partner toolkit. I am going to be sending out an email blast to those who are subscribed to the Live email list. And that's going to be part of the updates. We're going to put a link to where you can subscribe to that. But I'll be happy to forward that to you, Angel, the email that I release on Thursday, so that you can forward it to this group or whoever you'd like. And then glad to work with anybody on this call on what we might be able to get to you as far as information for either newsletters or social media or whatever it is you guys need to help us get the word out. We consider you guys our partners, and we definitely know we can't do it without you.
That's awesome. Thank you. That's great. Last time I talked to you, I didn't know you guys were going to do videos, and just like partner toolkit has been something that we've been talking about for a while with like the Affordable Fares Task Force. So we just are really appreciative of the work that you guys have been doing on this. I do have a question, and I think you were CC'd when I emailed Teresa, but do you all know when you're going to have the data of like how many people have been enrolled in each of the counties to date?
Yes, we actually have the first round of data pulled, but we are going through it and screening, kind of sifting through it. And here's the challenge with having the data when it comes down to county level. As far as the RTD district is, it doesn't sit perfectly within the counties. And so there may be certain counties that are only partially within the RTD district. So we may not be able to say, you know, if there's a county that's only half in RTD, well, that county is going to have a lower number. And it's, you know, it's going to be just one of those things that we have to heavily put some fine print on to have people understand as we communicate this, that, you know, numbers are going to vary for a variety of reasons. Numbers are going to vary because every year people have to reapply. So if somebody, you know, forgot to reapply, or they fell out of the system, or they no longer need it, those numbers are going to go up and down. And so there's going to be a lot of, I think, education that comes with these numbers as we put them out. But yeah, we have our first round that we're kind of going through the team and actually talk about how we're going to get to the right numbers and the appropriate numbers, so that we don't have to come back and have to say, oh, you know, we've kind of pulled the wrong ones, or we didn't give you the appropriate numbers. We want to make sure we give you the right numbers the first time. And the goal is here's going forward, as part of what I'm doing with the communication for LIV, is we'd like to continue putting the numbers out on a consistent basis. Now, what that looks like is, you know, maybe it's annual, maybe it's quarterly. Again, we have to talk amongst the team to see what makes the most sense. So you guys are seeing those numbers as we move forward.
That's great. I'm glad to see that you all are making progress. I know you have a lot of different priorities pulling you in different directions. I'm glad that you're making progress on promoting the LIV program. So thanks for hopping in and giving us that update. I did have a question about every year. For some reason, I thought that it was supposed to be every 2 years. And I don't know, Scott, if you remember that discussion on the past program working group, but I thought it was supposed to be certification for every 2 years.
It is every year. I don't think, privy to the conversations that you're mentioning, so I unfortunately couldn't speak onto if there was a shift and how that shift came about.
Okay. And do you have any numbers on how long it's taking people to get the card after they apply?
You know, I was actually asking for that feedback this morning. We were at about, and I will say this, a lot of folks didn't realize that Denver Human Services did have a little bit of a hiccup with their application process. So I know that there was a hang up just last month on those. I believe we were somewhere in the ballpark of, I know that we mentioned between 15 and 45 days in the video, but that could be different right now because of the different realities of whatever happens from week to week.
Okay. And we had mentioned this before you hopped on, I think. Is Kimberly Ford still visiting all of like the homeless shelters or talking to all the homeless shelters and the domestic violence shelters to talk about the barriers that they're experiencing with their clients?
Yes, the last time I chatted with her, she was still doing that. She's also heading up we have a homelessness task force that she's heading up, that she's asking different groups to come in and work with different staff groups at RTD. So I know she's got that going on a regular basis, and maybe that's something she can update you all on what she's working on with them. But she's constantly in communication with them, certainly.
Okay, well, I'll reach out to her for next month to see if she can give an update on the homelessness task force.
Wonderful.
Thank you. I know that I know you weren't expecting to be grilled like all these questions. So I'm glad you joined.
Angela, we talked about this a while ago, and I wanted to make sure that you knew we made good on our promise. You know, it took us a little bit longer, but we threw videos in, so I think we're going to be in good shape when we launch. Thank you again for giving me a minute.
Awesome, thank you. Okay, so let's go ahead and move on. I think that unless Lisa, did you have anything else for VIA? I know we were kind of wrapping up there.
Yeah, really only the other big news would be that Susan Unger, who is our travel trainer, is going to step out of her role. She has moved up to Nebraska to be with her family and her grandbaby. And we have hired a new travel trainer. Her name is Denise, and Hank, help me out because I always butcher her last name. But she is started already, and she is Susan's working remotely with her, and get out there and we're started doing some travel training. So we've had some requests for it. So more to come on that probably in the next month after she gets all of her learning in, as there's quite a bit to learn and figure out.
Lisa, this is Michelle. Will the contact phone information for Denise be the same?
I know that she's waiting to get her new phone. It may be different. So let me check on that and I'll get back with you.
Well, if you send it to Angel, maybe Angel could send it out to all of us. That would be great. And her email. Yep. And then is she also bilingual?
No, she is not.
Okay. So, Denise is probably wonderful, but I'm going to miss Susan Unger too. But go ahead, Hank.
Right. Her last name is Stradiotto. Stradiotto. And she is bilingual. Unfortunately, the second language is Chinese.
Oh. Yeah. So,
well, that's good to have that skill set, but yeah.
So, and Michelle, if you have questions, like in the meantime for Spanish speakers, Anna can probably help work with VIA and you all to ensure that Spanish speakers get some information on how to use the bus.
Well, we also have some staff who we might, partner with VIA around that. So yeah, great. We'll figure that out.
Okay.
Yeah, we have bilingual people here as well, so we can. We'll get it all figured out based on what people need.
Okay, great. Well, I'm happy for Susan, but I'm a little sad that we're gonna miss her. She was always like so full of life and like.
Yes. Yeah. I will pass the word along to her.
Okay. Do we have any other comments or questions on VIA? Okay. Thank you, Lisa, for the really substantial update. I really appreciate all that you guys do. So next we have Audrey De Barros. Are you on the call? I thought I saw you pop in earlier.
Hi, Angel, I'm here.
Hi. So Audrey is taking the lead on the 119 first and final mile. And let me switch out. You still want me to do the presentation, right?
If you're okay with that.
Yeah, for sure. Let me just pull it up. Okay. So let me know when you want me to advance.
Okay. Thanks for a couple minutes on your agenda to give a quick update on a new first and final mile study that Commuting Solutions, the City of Boulder, City of Longmont, and Boulder County are partnering in. We just started this project this spring, and it will continue for about the next year. Next slide. I think, Angel, your group is pretty familiar what the first and final mile term means, right? Correct?
Yeah, you can go ahead and give a little refresher though, because some people might be newer.
Okay. Well, first and final mile is a transportation term that's a little jargony, but basically it addresses the bike, pedestrian services and programs that can really make a difference into how someone is able to access transit or cycling facilities from where they live or where they work or their final destination. And so it's a really important issue to stakeholders that you work with in particular to make sure that they have safe and convenient and reliable access in order to get to the future bus rapid transit and future corridor-wide bikeway that's envisioned for the State Highway 119 corridor between Boulder and Longmont. Next slide. The study, as I mentioned, is about a year long, and it will in particular take a deep dive looking at connections in the corridor. As I said, safety is a really key priority for this corridor, recognizing that it is a very auto-centric, fast-moving roadway. And so it has, it's also a very wide roadway. So identifying the infrastructure that's needed in order to make those crossings safer for bicyclists and pedestrians is a really important component of this study. Wayfinding signage is another element. Transportation demand management services, looking at the work that RTD did for last year for TDM in the corridor, it will be a starting point. And then considering shared parking and opportunities to work with existing landowners so that we can add parking at a future Gun Barrel station. And then microtransit, looking at different ideas for how we can improve access for residents as well as businesses in the area of Gun Barrel are the main categories of this planning effort. Next slide. So we have completed baseline data collection. There's been a lot of existing corridor and local planning work that has already been completed. Most recently, RTD completed a planning and environmental linkage study last year, and there are a number of planning efforts that are getting going this year, both locally within the city of Boulder, city of Longmont, and then Boulder County is leading the final design for the bikeway. So this is just another additional project, planning project that's planning or underway this year. Public engagement, of course, is a really key component for the months of July and August. We are hosting 3 town halls. Our last one is this Wednesday, which will be Spanish only. We are also hosting an interactive web map where people can go in and let us know where there are intersections or specific locations where bike and pedestrian facilities in particular would be beneficial. And there's also a survey that people can complete. I'll add the project webpage to the chat. So if you are able to give us some input, we would greatly appreciate it. As part of this planning effort, we will develop corridor-wide recommendations. And we are also implementing a deeper dive at 3 to 4 bus rapid transit stations in the corridor. Phasing, funding, and cost estimates will obviously be a part of the final document as well. So that's where we're at. We're just really getting started with the study. Our first phase of public engagement, as I said, is underway currently. Angel, I believe you sent an email to this group, correct, regarding 2 walking audits that we're starting?
No, I sent it to about 10 people with disabilities that I knew along, like who were connected to it. So I have gotten one response back. Basically, they're looking for individuals with mobility limitations, either in mobility devices or some other limitation, to participate in a pedestrian audit that's coming up at the end of the month. One person's gotten back and said that they don't feel comfortable like going out now just because of COVID, even if it was on their own. But I will follow up with them to see if we can find somebody. Just if any of you all know of anybody who's interested, people can do a group walking pedestrian audit, or they can do it on their own and get instructions on how to do it. Just so that we can get the perspective of people with disabilities and limited mobility involved in that.
Thank you, Angel. Appreciate your help on that unique need.
Yeah, no problem.
I think, is that the end of my slides?
Oh, okay. Yeah.
Oh, okay. This is just a slide to describe the process, the main tasks identified, and the timeline to complete those, which I already covered verbally. So, as I said, we're in the middle of looking at in particular, the Gun Barrel and State Highway 52 intersections, we're just scheduling pedestrian audits August and September for stakeholders who use those areas. And completing our first round of public engagement. So I'd be happy to come back to the group once we have a little bit more to report in order to receive some feedback from you directly.
Yeah. So have you had good attendance at the virtual workshops? I'm always interested to see or the virtual town halls. I'm interested to see how participation changes when it's virtual.
Yeah, I think it's been pretty good. We had over 100 people in our first one, about 60 last week. Our one on Wednesday, as I said, is Spanish only, and our attendance so far in terms of RSVPs is quite a bit lighter. This is the first time that we're hosting a Spanish only town hall online. So it's been just, a learning experience for all of our partners and myself around how to get people to attend.
But you all are recording them, right? Because just generally speaking, as far as my experience with Spanish language engagement, we end up getting more watches after the fact than what we get at attendance, at the event. So
that's good to hear. Well, thanks for letting us know that.
Yeah. Okay. Does anybody have any questions for Audrey on this project? Okay. I do have one question about the station design, the BRT station design. At what point in this would you get, it's probably after this project, right? Are you going to get into the details of what the stations look like?
Yeah, that will be a separate effort led by RTD, complemented by CDOT.
Okay, yeah. So I know that one issue that people with disabilities have talked about with Flatiron Flyers is the need for a lift versus having ground level boarding or level boarding.
Mm-hmm.
I know that there's some frustration with how long it takes to use a lift, when they're using coaches. And I'm sure that our project team will definitely voice that throughout the planning process. But I know that we've worked with people with disabilities who feel like that is a little bit that slower boarding process, puts a lot of attention on them for slowing down the bus or whatever, right? I mean, it's not, of course, it's their civil right to use the bus, so they shouldn't feel that way. But just in general, I've heard people express some concern about having the lift. I don't know if Jamie's still on the call. I know that CCDC might have some opinions on bus rapid transit boarding. Jamie, are you still on the call? Okay.
Yeah, I'm still here. Yeah, we try to avoid this at all possible, not just for the person with a disability, but the general public. It slows things down and, it interferes with the bus schedule as far as I'm concerned. It takes so much time to load somebody. So we try to avoid them when possible.
Yeah.
Yeah, I participated in the BRT vehicle selection process for US 36. I think just for those of you who are able to participate in that as it comes forward for State Highway 119 would be really valuable. There's just, looking at a vehicle type that's unique to what RTD already offers in terms of its vehicle fleet was something that, there are a lot of factors around, the maintenance of it, the storing of it, the stations being able to fit the vehicle. I mean, there's just so many factors that go into a vehicle selection type. And obviously they were reluctant to try something different on US 36, which is why we ended up with an over-the-road coach vehicle. So, there's opportunities. It's been 4 or 5 years since we launched the Flatiron Flyer, So times are changing. You know, there's a new general manager who will be coming on board soon. So I would welcome having your voice participate in that process.
Yeah, great. Well, thank you. And Audrey, you did have one more slide. Sorry to like jump in with the questions before you were done.
Oh, okay. This is just some of our public engagement. We do have a stakeholder working group of representing nonprofits, businesses, and local jurisdictions and transportation partners who are a subgroup of our staff team. As I mentioned, we're in the middle of public engagement right now, and we'll be developing recommendations or draft recommendations later this year.
Okay, great. Thank you. Does anybody have any other questions for Audrey? Okay, well, thank you so much, Audrey. I appreciate it.
Thank you.
Okay, so we're going to move on to the program evaluation that we conducted. So this will just kind of be an introduction to it. We definitely need to dig into this a little bit more. But just so you all know, let's go ahead and do this one. What we did is we wanted to get an evaluation. This was basically tied to the funding requests that we give to the commissioners every year. And last year, we were just talking with the commissioners about funding sources and just about like how the program's doing. So we decided this year that we would do an analysis of like how well Mobility for All is doing, and then also dig a little bit into like what people are expecting from the local coordinating council. So basically we hired a consultant to do a SWOT analysis, what is called its strengths, weaknesses, opportunities, and threats. So basically the top, the strengths and weaknesses are current situation, and then the opportunities and threats below are kind of future oriented. So as part of this evaluation, we conducted 9 stakeholder interviews, and some of those interviews you all participated in, and some of them were, I think all of them had multiple people in those interviews. So for example, when we were interviewing the local municipalities, we were sure to include a transportation planning professional as well as a human services oriented professional. Also, we interviewed 5 peer agencies, and I'll go into who those agencies were. We also conducted a survey of the end user, and some of you took that survey as well. But also this survey was dedicated, or it was directed primarily towards people who receive information and referral services from Mobility for All, or eco passes as part of the Housing Authority, or have attended the technology workshops, or have received pass support, like transit pass support from us. And then as part of this evaluation, we also had the consultants go through some outcomes-based evaluation framework for us so that we would be able to have better performance metrics as we move forward on the projects that we have. So that's kind of a snapshot of what we did. Our priority items, first of all, do you all have questions on the process before we move on? Okay, so I'll go ahead and move on. So our top priority are, items, and this was based on what we heard from other peer agencies, and then what we heard from you all, and what we heard in the survey. Our top priority items were that we need to improve the marketing and visibility of the program and the LCC. Number 2 was strengthening metrics to demonstrate results and outcomes. So I think that a lot of you had provided feedback that we attend these meetings, but we don't like necessarily know what it results in. And so we want to make sure that we have more updates on what is the impact of us attending these meetings. We also had sustainable funding, which is going to be challenging in the COVID times. But basically what this resulted in is it's just really hard to facilitate the LCC and run Mobility for All when it's just me. And I mean, of course, we have Aiden and Anna here now, which I'm so grateful for them being here, but that position is an hourly, those positions are hourly and there's more turnover. So just really trying to find sustainable funding so that we don't have just like one person all year, and with other people like popping in to help different points. Another top priority is to strengthen our project practices. So that's managing our projects better, like following up and giving reports out on our projects that we're doing. This one is the one that we are going to focus on a little bit more at the next meeting, improve the LCC design and inclusive planning. So we'll get into that a little bit more, but one thing in particular that other mobility management programs that facilitate LCCs did is they really broke the LCC out into different working groups that were a little bit more targeted based on what demographics the nonprofits or the organizations served and like what the problem areas were that they were trying to address. So think about the East Boulder County Transportation Gaps like working group that we had a few years ago, where we had a smaller group of stakeholders who met like 5-6 times to really try to dig into what the gaps were between Louisville and Lafayette. And then the result of that was to apply for the Ride Free Lafayette service, the funding to fund the Ride Free Lafayette service. That wasn't the only thing that led up to us applying for it, but that was kind of a smaller working group that was working and meeting for a very specific problem that they were trying to address. And then there was the specific outcome that happened because of that working group. So we're thinking about that kind of design aspect, and I'll need to talk to you all about who's interested in talking about redesigning the LCC and how we meet and when we meet and such. And then another thing that we heard really clearly was that there's transportation differences for different subpopulations within Boulder County, and that you all wanted to see us focus on like the subpopulation problem areas a little bit more. So think about like wheelchair users who are trying to get from Lafayette to Longmont. Like that's a very specific transportation gap or a transportation challenge. And so some of the recommendations that we had were to really have working groups that focus on like Spanish speaker needs or youth needs or healthcare access needs. So this, of course, we don't have all the answers of what those sub-working groups would be like or what we would address, but that's just kind of the start of this with you all. Do we have comments on like what these priority items were before I move on, just to talk about like who we interviewed as far as the peer agencies? For those of you, thank you, Eugenia. Eugenia said that she thinks it's great. For those of you who were interviewed, do you think that this accurately reflects what you were saying in those interviews? Okay. So I feel like we're getting towards the end of the meeting and people don't want to. So Lisa said yes. Okay. So we'll dig into these a little bit next session to talk about what that looks like. So the peer agencies that we interviewed, basically I contacted the Community Transportation Association of America, CTAA. They're the people who funded our inclusive planning effort the last couple of years. And they are kind of the resource hub for mobility managers who facilitate local coordinating councils. So I asked them like who they thought we should be interviewing, and they recommended Hope Link in King County and Seattle. They recommended Maryland Department of Transportation, Rabbit Transit, Ride Connection, and Tompkins County in New York. Rabbit Transit, sorry, this one is in Washington State. This is Maryland and outside of Baltimore. This is in Pennsylvania. Rabbit Transit's in Pennsylvania. Ride Connections in Oregon and Portland, Oregon, and Tompkins County is in New York. So we talked to them in depth, and we got some great ideas, wonderful information. I think that from an LCC facilitation standpoint, I really got a strong guidance and information from Hope Link and Tompkins County, because those two are the ones who are like the backbone organization for their LCCs. I think with Ride Connection in Portland, Oregon, their LCC was facilitated through their transit agency, through TriMet. Rabbit Transit, they have something that's similar to an LCC, but they're a new nonprofit, so it wasn't as fully developed as like an LCC. And then Maryland Transit Administration, they didn't have an LCC that they facilitated, and it seemed a little bit like their LCC was a little bit more bureaucratic. But they really will be digging into like what Hope Link said and what Tompkins County said. And just kind of a little snapshot, both of them said that the key that they've found to having like a really solid LCC is coordinating on like those funding of projects and applying for joint applications, which I think we're doing to some extent, but we could probably do better. So, I mean, just that example of the Ego car share and VIA pilot that we applied for with the electric vehicle. I mean, that was a collaborative application. And then VIA Mobility Services and Mobility for All, like we go in to get mobility management funding together. So VIA takes the lead on applying for that. And then my part of my program is funded through that same grant. So I think that we can learn a lot from these two organizations about how they structure their LCCs as a way to coordinate funding projects. Do we have questions on peer agencies and like what we learned from each of them? Because I'm just doing a little brief overview on these. So you might want to know like specific questions of how they're administered. Okay. So I guess my question for you all is, since I've been working on the LCC facilitation, it's been about 5 years, and I know VIA used to facilitate the LCC. So I don't know if Lisa Curtis or Lisa Bitzer, if you were involved, or who was involved in the LCC before Mobility for All facilitated it. I guess I'd like to hear from you all.
Yeah, I do remember being back in those days, and was a lot of riders that we had on there that I remember. So they were RTD riders, VIA riders, and other riders. So that was a big part of it for many years. I don't really remember a whole lot of organizations. I know we always had someone from CPWD, places like that, but I don't remember a lot more than just that. And they served lunch. I do remember that it was a way to get people to come to the meetings. And so they were very well attended due to lunch being brought in.
Yeah. Michelle?
So there was two things that kind of happened parallel. We had finished the age well planning, and transportation was a key issue that came out of the age well plan, the countywide plan. We formed a group to address ease in transportation, affordability, access, etc. About the same time, the county started to look at the LCC approach, and we ended up merging. And so the folks who had been involved in the age well piece were staff from all the city, municipal, senior services and county aging services, as well as some of our partner agencies. We had folks from the mountain communities, resource specialists from up there, VIA, of course, Cultivate, Adult Protection was involved. And our group didn't serve food, but we did end up merging because it made no sense to have two different approaches looking at ease and affordability and access regarding transportation.
Yeah, makes sense.
So those things sort of came together kind of in a parallel way.
Yeah. So I guess kind of my thoughts are just like with our inclusive planning process that we've had to get individuals who are using the services involved like in a more sustainable way, it seems like they really want a very specific project that they can contribute to, right? And so they're not as much about just like the general transportation system, right? If it doesn't directly impact their mobility, then, I mean, I've had a few of those people who were involved in the inclusive planning process attend the LCC off and on, but they just don't feel like they are contributing. And so I think part of that is on like me to like look at how we can ensure that they're involved. So I guess moving forward, we'd like to talk about if we could have a subgroup that can talk about how we can structure the LCC to ensure that we're getting the end consumer involved in this. And perhaps it is with like we meet quarterly as like more of like a policy like group. And then like every other month we meet like on more project specific. So I'm just, I'm concerned with not consistently having enough representation of like people with disabilities, older adults, and low-income households who could directly impact the transportation network. And then also, I guess my only like form of reference is the Pikes Peak Area Council of Governments Mobility Coordinating Coalition, because that's what I facilitated before. And there, that was much more about coordinating funding streams. And because I was located with the Area Agency on Aging. And so basically we had the transit agency and it was much more formal as well too. Like we had appointed positions and we had like the transit agency and the Metropolitan Planning Organization and the Area Agency on Aging all have like a seat at the table because they were funders. And so it seemed like there was that loop back to like that funding mechanism a little bit more clear. Whereas here, ours is a little bit more informal and we don't have that strong funding component. So that's something that I think the group would really look into a little bit more because it does seem like, especially with Tompkins County, they definitely had a strong funding component to the LCC. Do we have any other questions on that?
Angel, I do have a question. So the county has a number of boards and commissions, including the Area Agency on Aging Advisory Council.
Yeah.
Are there some existing groups that have individuals who use the various components of the transportation system that might provide input or ideas? I don't know, just thinking of some existing opportunities.
Yeah. And I think that also like bringing the transportation discussion to different organizations, I've had more success with as well. So for example, like the interagency transition team, and Anna Stewart, you're on the call. Like I've been attending those meetings to give the transportation updates. It's more of like an information sharing. And then I've been attending the, and I think Whitney Wilcox is also on the call perhaps. Let me scroll down, maybe she hopped off. But I've been attending their local area collaboratives to give updates because they have their collaboratives for human services organizations. But it's been an update on what transportation changes have happened. And it hasn't been like with the specific involvement on like help us guide like what our priorities should be, I guess. And then also like another component of what I did with the LCC in the Springs was really more like service coordination of like providers. And that doesn't seem to be as big of a need here because VIA is like the primary provider. Whereas like in the Springs, we had like 4 versions of VIA, right? Who all had to coordinate their services. And it seems like VIA has taken, and I don't know if Lisa Bitzer, you want to hop in this discussion, but VIA's taken the lead on like coordinating with Accessoride and coordinating with Cultivate when you guys were doing medical mobility, and then coordinating with Eco Car Share.
Right, yeah. I mean, it's definitely the way, the more coordination that you can do, the more people you can serve, right? So, you know, you've got to really think outside the box. And, you know, we did that with Assessor Ride. We did it with Call and Ride back in the day. And then, of course, Cultivate and many others. We currently do it with Broomfield Easy Ride. So it's really the way to be able to help people cross boundaries that are not so easily crossed when they're traveling. And so that seems to be the way to go, and also the way to get grants to be able to pay for those kind of things, because we know the town to town, or the, you know, from Boulder down to Denver and places like that, are the ones that are hard for our riders to get those rides. They're time consuming. It takes a long time to go from point A to point B. So the efficiency for a transportation company isn't the greatest. And that's where, you know, volunteers come into play, and using other companies. And if they're, you know, putting all the resources together to be able to get people these rides.
Yeah.
Angel,
oh, go ahead.
So just another thought, which is, so two thoughts. One is VIA has traditionally done a really good user survey. Sometimes that's been shared with the LCC, and sometimes I think various times it isn't. And there's probably not everything that we need to know, but I think organizations that transportation's their mission, their business, sharing that real data with us collectively, I think would be helpful. The other thing is, I think that when you bring in, it's important to be really clear about what you're asking from users. And I am not a believer in creating projects so people are invested. I have my own advisory committee, and I get it in terms of meaningful work, what is meaningful, what's appropriate. And I think we just want to be mindful of that. And definitely we need consumers, clients, customers, users at the table. But let's use everybody's time appropriately.
Yeah. Okay. So was there somebody else who
It's Lisa Curtis. I'd just like to add that we'd be happy to forward the latest version of our writer survey to be shared with the LCC. And also, should I just send it to you, Angel?
Yeah, I think I have it from when Zoe gave it last month or the month before. She gave an update. Yeah.
Okay.
So I'll forward that out. So so moving forward, who's interested in meeting like once a month, probably like mid-month, to really focus on the structure of the LCC and how we can make the most of our time, and not necessarily, because we do have long meetings, right? And they have been more like information oriented, where we get presentations from people. But if we do talk about going to more like a work group style, like who's interested in that discussion, and how we can do that moving forward.
I'd be interested. This is Lisa Curtis.
Okay. Okay. Anybody else? Does anybody, and we'll go into this a little bit more next meeting. I think I'm going to start using Menti to get like more engagement from like phones, like we did that with Dr. Cog. So I feel like it can be intimidating. So I see that Rebecca's interested, Eugenia Brady is interested. Okay, great.
Angel, I'm interested in, this is Malia with Dr. Mack. Interested in any way we can be of help. I'm in.
Okay, great. So Rebecca, Eugenia, and Malia, and Lisa. Okay, I think that's a good group size. If anybody else is interested, we can definitely include you as well. So we'll just talk about just different ideas of how we could structure it and like how we can make the most of everybody's time. Okay, so just to kind of give you an overview, we did at the survey, we had 155 respondents, and the assistance that we gave, I think like 47% said that they're very highly valued, and 32% said that it's high value. And then we have, I'm going to dig into this 10%, like 10 people, 11 people here to see like what services they received. I still need to get into the survey to see like which, what breakdown people were of like receiving transit passes versus information on how to use apps to access transportation versus referral services to VIA or RTD. So I'll look into that a little bit more. But a snapshot of what people said. They said the frequency that they have challenges accessing transportation, 49 or 59% said infrequently, less than once a month. And that could be because, I'll have to dig into who said that. It could be because a lot of people who took the survey were receiving eco passes from RTD. But about 24 people said that they had on a frequent basis. They had transportation challenges. So I'll dig into these numbers a little bit more to see like what sorts of programming. The transportation that people said that they needed, the top to go somewhere outside of Boulder County. That was like 49% of the people said that that was their biggest gap. Or sorry, this is raw numbers, not percentages. So and then people could select multiple. So 49 people said that outside of Boulder County, 47% said going to the doctor, 45% said going to the grocery store, and then the next highest was writing off hours. So 38% said off hours, weekends, evenings. So we'll dig into this data a little bit more as we move forward with the LCC, just to see. And just so you all know, this input data will go into the Coordinated Human Services Transportation Plan that we'll be launching at the local level to kind of flesh out what we have in the Transportation Master Plan. But that was pretty much a snapshot. Are there things from the program evaluation that you want me to dig into a little bit deeper for the next meeting? No? Okay. Are there any needs that you heard in this meeting and solutions or potential solutions that you want to bring up? No. Okay, great. So I didn't change the date on this. Sorry, the next meeting we'll have in September. Let me double check the date on that meeting. Sorry. I think it's the 10th, but I don't want to misspeak. So we are meeting again on, no, it's the 14th. So September 14th, and we will go a little bit more into the program evaluation and how we can move forward. I will be reaching out to the 5 people who said they're interested in talking, or the 4 people that said that they were interested in talking about the makeup of the LCC. But that's all we have. Thank you so much for attending. I appreciate it.
Thank you.
Thank you. Have a wonderful day.
Thank you.
Thanks, Angel.
Thanks.
Thanks, Angel.
Bye. Thank you.